Today we're going to do a newborn assessment. I'll keep my stethoscope handy. We'll start with the APGAR score of a newborn. It's performed at 1 and 5 minutes after birth, just to check the baby's adaptability to life outside of the womb. So you're going to check the baby's appearance, color, which would be, if it's within normal limits, pink, blanchable, that would be a score of 2. There's 5 sections, each one is a total of 2 points. You want the highest grade is a 10. Between 7 and 10 is a normal APGAR score. You also check baby's responses, respirations, heart rate, those sort of things. Also muscle tone. The baby should have some sort of muscle tone after birth, and baby's cry or response to being suctioned and things like that should be normal responses. If there's no cry and no respirations or low respirations or heart rate lower than 100, then that needs to be assessed, and that will be given a lower APGAR score. So we're going to start with just checking baby's vital signs. If the baby's asleep, you want to do certain things that won't wake the baby up. So you can do like check for respiration rate, do things that won't irritate the baby, and then it'll be harder for you to assess the baby. Vital signs: blood pressure, apical heart rate, 1 full minute. Also check baby's motor abilities. Then we're going to check reflexes. You want to do like the rooting. You put your little finger next to the baby's cheek and see if the baby will kind of turn towards your finger, like rubbing their cheek. Check their suck reflex. You can just put a gloved finger in their mouth and see if they suck. Also Babinsky, you can just kind of stroke the bottom of their foot. Their toes should fan out. Big toe should kind of turn towards the foot. Now I'll do more of a head-to-toe assessment on the baby since it'll be more organized. With babies, you always want to check the head circumference and document that, and it should not change. And if it's larger than normal, we have to look into like hydrocephalus, or if it's smaller than normal, then we have to look for like microcephaly or causes for that. Fontanelles should be nice and flat and soft, not bulging or sunken. Bulging can mean that the baby might be a little overhydrated. If they're sunken, it could show signs of dehydration. So the anterior one is palpable between 9 and 18 months. Posterior should be also soft and flat, and that's usually there for about 3 months after birth, palpable for 3 months. Check the pupils, check eye positioning, check just basic appearance of the eyes. If there's any problems or any changes with red reflexes, obviously ophthalmology should be discussed or contacted. And then just check the baby's skin color too, make sure it's pink. The hair needs to make sure it's not brittle. That could also show signs of dehydration or inadequate feeding. Parents should discuss that with you. Question them about eating habits and make sure the baby's latching on when breastfed, or if there's any problems with feeding that we need to be told so we can rehydrate the baby and get the baby adequate nutrition it needs. You'll check the neck and head, the tone of the baby's head and neck. They will obviously not be able to hold up their own head at this age, but that should be checked. You want to measure the chest circumference and also the abdomen, and those will be assessed. They should be nice and round but soft. Also ask about normal bowel movements with the parents, because it's not normal for a baby not to have poop for a day or two. They need to have regular bowel movements and have up to 4 to 6 urinations a day. So ask about how many wet diapers they have each day, those kind of things, because that can show signs of constipation or dehydration. Also, we want to look at just the peri area and just make sure that the scrotum, if it's a boy, or the vaginal area looks normal in the baby. The anus, to make sure that there's no abnormalities there. I've seen some in newborn baby boys, their scrotum's really large, or they have signs of hernia, so you have to check for those sort of things. Also check the tone of the legs, cap refill, those sort of things that go along with cardiovascular. But just a general survey of the baby overall should be checked too, to check for muscle tone, make sure that their respirations are not labored, those sort of things that need to be handled right away. Those are priorities. So any concerns should be discussed with the parents also. And then everything that's abnormal should be discussed with the physician, but also documentation should be done on everything found on the baby, whether it's normal or not.